purposes for treatment of psychiatric patients. But there may be very limited circumstances when I will use my psychiatry knowledge not for treating patients, but for helping the law, legal people like a judge or like a lawyer or like a police officer. And when I use my knowledge of anything, not for the treatment of a patient, but for the benefit of a judge or a lawyer or for the legal people, then we append the word forensic before it. So forensic medicine is application of medicine for the purposes of law. Forensic serology, for example, is use of serology for purposes of law. Forensic radiology is use of radiology for the purposes of law. Now you might wonder how one can actually use radiology, for example, for purposes of law. How possibly can you use it? I'll just give you one example so you will get some feel of it as to how these things can actually be used for legal purposes. Now, please remember there's a law in our country that a person who is below 18 years of age, if he commits a crime, he will be tried not in a normal court, but in a juvenile court, where the sentences are less. And it's for a very good reason that children must not be given very harsh punishments, and they should be treated more lightly. They are more amenable to improvement. So instead of treating them in adult courts, you take them to children's courts and give them light punishment. So even the biggest punishment there is just 3 years. That's all. Even if somebody commits murder. Now people take advantage of it by saying, let us say, a 23-year-old man. People who have come to me, 23-year-old man, he has committed a murder, but his lawyer has advised him to say to police that he is only 17 years old, so that he can be tried in a juvenile court rather than an adult court. Because at the most, even if he is convicted, he'll go to jail only for 3 years. So now here we are having a man who is having a mustache, a beard, a very well muscular man. Any dumb person can say he's at least 25, but he appears, he's claiming that he's 17, and the court has sent this man to you. So what I do is simply, we all know that the shoulder joint, ossifies completely at 18. So here I am taking a X-ray of the shoulder joint, not because he has got a fracture, or I want to settle his bone, or I want to put a plaster over it, or some disease of the bone, but I'm taking his X-ray just to see whether his epiphysis is united or not. If it is united, I can tell to the court, look here, this man is above 18. And if he is not united, I'll say, yes, he's speaking correct. And he is below 18, so please, you can take him to juvenile court. He's entitled to juvenile court. This is one good use of radiology for legal purposes. I have not treated here anybody. Actually, nobody is ill here. But I'm using this knowledge for the purposes of law. Now, how I can possibly use the knowledge of psychiatry for law? Now, let us imagine that somebody has committed a murder. He goes to the lawyer and he says, I've done a murder. The lawyer can jolly well say that you claim that you are an insane person. You might think that this is quite a funny thing to say. Who in the world will say I'm insane? But people do say that they are insane because they just want to save themselves from the capital punishment, and insane people cannot be given any punishment. So here you have a person who is feigning insanity simply because he wants to, bypass the law, and he wants to take the advantage of a particular section of the law. We have a section 84 here, which says that no insane man can be punished for any crime because he doesn't know what he's doing. There's no mens rea. Mens rea means guilty mind. So he will be sent to a psychiatrist. Now, the psychiatrist is examining him not because he has come to you for treatment, but because you want to determine whether he is really insane or is just feigning insanity. I'll give you another example. Quite possibly, a person is really insane, and let us say he's schizophrenic, and he is having hallucinations. He thinks he's seeing not you, but he thinks that you are a lion who is going to attack him. Now, what does he do when some really a lion comes and attacks him? He will actually try to kill him. Now, this is exactly what he has done. He has killed that man, thinking that it was a lion who was going to kill him. This is really that happened to him. But whether it really happened to him or not, whether he really did it or not, this is determined by, psychiatrists. Another very funny thing that happens is many people, especially those who commit murders at night, they say that they have a problem called sleepwalking. We call it somnambulism, that is sleepwalking. Now, whether this person really suffers from somnambulism, because if he is suffering from somnambulism, that is, he is actually sleepwalking. So during sleepwalking, you don't know what you're doing because you are actually in sleep. So you can probably get benefit of, this disease. But if you are not, having somnambulism, then the psychiatrist can tell that to the judge, look here, he doesn't have any problem. So is that clear to you? That psychiatry can be used for, legal purposes in a number of ways. Is this clear to you, all of you? If you have any questions thus far, probably we can take them right now. Otherwise, I can go on to the next, session. Is it okay, Nishtha, Assis, everybody? No questions? No questions received so far?
Hello, sir. I would just like to interrupt you for a little bit. So we have with us many students who are really excited to have you with us. We are GAIMS, who are a think tank of medical student issues and aim to provide efficient education to all Indian medical students that will allow them to be the best in the world. We achieve this by working with all government, private, deemed, autonomous medical institutions and colleges, academicians and leaders. And we are constantly trying to engage global medical academicians and educators to bring about efficient and quality education. So most medical students in India, they have forensic medicine as a subject in the third year of medical school now. So our students, they want to know that what are the future prospects of a forensic psychiatrist and how they can pursue a career in forensic psychiatry?
That's a very good question. And I can only tell you with a real example. We had a student called Akash Ahuja, probably 1992 batch or 1991 batch in Mansi. He was a brilliant student, but he was having some problem in his family, so he was not getting good marks. So I always used to encourage students. So one day I called him to my room, and I said, Akash, you are such a good boy. Why are you not? Why your marks are not coming so good? So he said, sir, I can't do anything. Like, he was very depressed because of some family problems going on. And I told him, you will do well in life, don't worry. So he said, sir, many people say that, but ultimately he did well. And once I was visiting my son in at that time, my son Tarun, he was in San Jose. So I didn't know, I knew that he was in US because before going to US, he met me. And so I mailed him. I said, I am in San Jose. So where are you? So he immediately, and I gave my phone number also, my son's phone number, of course. So he phoned immediately, within 5 minutes. Sir, I am only 400 kilometers from your place. So I said, only 400? He says, oh, 400 is nothing here. So, but I am coming today. We'll have dinner together. Then he drove 400 kilometers, took me, my wife, and my son to dinner somewhere. And there I asked him what you're doing. And he said, sir, I'm in forensic psychiatry. So I said, you are in forensic psychiatry, really? How much do you make? So he said, how much do you think I must be making? I said, probably $200 an hour, because $200 an hour in US is a huge amount, according to me, or $200 or $300, because somebody told me, I think my son or somebody, that the woman who gives you grocery gets around $5 an hour. That's the most bottom, $5 to $6. then some chartered accountants will get 40 to 30, 50, something lawyers will get 100, doctors will get 200. He said, sir, I'm getting $900 an hour. $900. I was amazed. I said, this is the amount that people get in forensic secretary. He said, yes, but I had to do a residency in secretary, and then I did fellowship in forensic secretary. So forensic secretary is like a DM there. So but he's doing excellently well. His name is Akash Ahuja. I do have his number and his email. Anybody who wants, you can actually contact him. So forensic secretary actually has excellent scope. In India, I wouldn't say he would be that good, but yes, if he becomes a consultant to some kind of a lawyer, because lawyers will deal with cases, and he gets associated with a lawyer in some kind of a advisory capacity where he will be advising on him on how to like prove his client insane or not insane or whatever, then probably he can make a good amount of money. So forensic secretary, I would say, is an excellent branch. Any other questions? If there are,
Yes, so
yes.
we have this was definitely great. We have so many questions with us. Students would really like to know, like, how can Indian students pursue a career in forensic psychiatry, like as a hardcore career, apart from going into specifically medicine? So, like, what is the way to become a forensic psychiatrist here in India?
No, there's, I'm sorry, there's no way to bypass medicine if you want to be a forensic psychiatrist. Because as I told you, a forensic psychiatrist by necessity has to be a psychiatrist first. The only difference between an ordinary psychiatrist and forensic psychiatrist is a psychiatrist would use his knowledge of psychiatry for patients, while a forensic psychiatrist will use his knowledge of psychiatry for legal purposes. So if you, I mean, if I have understood your questions correctly, he is asking that without entering into MBBS, how he can become a forensic psychiatrist. Is that the question?
No, sir. Like, as in after MBBS, since in India we do not have any specialty which specializes in the field of forensic psychiatry.
Yeah, that is there.
So,
That is of course there. There is one way to bypass it, but I wouldn't say that's a very good way. And I don't also know whether it would really work. One or two people have actually tried it. I mean, probably stopped somewhere in between. It is to do 2 MDs. You do one MD in forensic medicine and another MD in psychiatry. So you have a knowledge of both. But unfortunately, in psychiatry, they won't teach you much of forensic, and in forensic, they won't teach you much of forensic psychiatry. So that won't be really a bright idea to do that. However, I do know a few people who tried to do that. But if somebody joined psychiatry first, so he became ultimately he became a psychiatrist, or if somebody joined forensic first, so ultimately he became a forensic man, and never actually, because then he has to pass another examination for psychiatry, and that becomes very difficult. So that's in India. To be very honest, forensic psychiatry, to enter into forensic secretary, the chances are not that good. But as I told you, this is not so in US and even in Britain, where you have specialties called forensic secretary, where you can do, you see, fellowships. And I do know people who have done fellowships and who are doing well. If there's any other question, you can ask me. Vishnu, is that okay?
Yes, sir. Vishnu, just take it.
So there's been a question in the chat box. They want to know what has been your most landmark case which you have come across in your career till now. What case did you find the most memorable in your throughout your career?
All right. Aman, are you asking only from forensic psychiatry or from any of the forensic case? Because if I am restricted to forensic psychiatry, then I'll have to think of those. So what kind of cases? Because I've done very good cases, but they are not necessarily from forensic psychiatry. In forensics, sorry?
We would love to hear them both. We have ample time.
All right, great. Well, this is actually, such kinds of questions are difficult because it's very difficult to pinpoint any one case as the best, because sometimes 3 or 4 are very good, and probably 10 to 20 are so good that, I mean, some aspects of one case are excellent, while some other aspects of another case are excellent. And I was not actually expecting this question, otherwise I would have given it a thought. Anyway, but what I can think immediately is this case, Shoaib Ilyasi case. Now, this case I'm telling you because Shoaib Ilyasi was a kind of a celebrity, a minor celebrity. He used to run a show in TV called India's Most Wanted during 1990s. Probably either you were not born at that time, but it was a very popular show. Still, if you go to YouTube and write India's Most Wanted, you can see 1 or 2 episodes of it. The show was basically, it was, I think, based on America's Most Wanted, where they used to show the crimes of one particular criminal who is at large, and you want to catch him, so they will show his pictures and they will show his crimes and how he changes his appearance and how you can catch him. I mean, if you catch him, just phone us, things like that. Now, this person, Shoaib Ilyasi, and he was married, Anju Ilyasi, and they had a daughter. On his name, his show used to run actually. Now, there was a fight between these two. I mean, they were newly married, and there used to be a fight between these two. And as the story goes, this case is all over the net. You can read it. There are some episodes also of Crime Patrol. Some episodes have been made on it also. Now, once there was such a fight, there's this Anju Ilyasi, she during the fight, she called her sister somewhere in Canada or US, and she said, Shoaib is going to kill me. And as Alia Ilyasi, yes, that's right, Alia Productions. Vivek Singh has said Alia Productions. He remembers very well. So Alia was the name of the daughter. So Alia Productions, it was Alia Productions. So as she was saying he was going to kill him, she was actually stabbed. And she was stabbed. And then, according to the story, Shoaib Ilyasi ran down and told some people sitting outside, because he gets a lot of security. They said that he said the security that this Anju has stabbed herself, so let us take her to the hospital. They took her to the hospital. She was not in a position to give any kind of a dying declaration, and she died without giving any dying declaration. Now, when the postmortem was done, I was not involved in the postmortem. 3 doctors were involved in the postmortem. 3 different doctors. I think one was from All India Institute, one was from Safdarjung, and one was from some other place. And they made a postmortem. They did a postmortem, and they differed. Now, the main question was whether this girl has committed a suicide or whether Shoaib Ilyasi has murdered her. This was a very pertinent legal question, because on this everything was based. Now, 2 of them said that it's suicide, and one said it's homicide, or probably the other way around. I don't remember it. However, there was a deadlock, and he used this deadlock to get some relief from the court, and this case was ultimately buried in files. So nothing happened to Shoaib Ilyasi. Then this is actually 2001 or 2002 case, I think, around that time. Then this case laid buried in files. In 2011 or 12, her sister, who was very active, she woke up the courts again. And then court, because we didn't have the body of Ilyasi, Anju Ilyasi, to do a second postmortem. In foreign countries, where they bury the body, the bodies can be exhumed. and a second postmortem can be done. But that facility we didn't have. The only thing that we had was the first postmortem report. The government, in its wisdom, made a board of 5, because if you have to override a board of 3, you have to make a board of 5. And in their wisdom, they thought that the best person to be made chairman was Dr. Anil Agarwal. So they made me chairman of that board. And all these 4 doctors were from 4 different, hospitals. And because I think 2 or 3 of them were my students, so there was a fear that Anil Agarwal can actually influence them. So I said, let there be an observer who is not my student. So then we did that on my insistence. And also I said, look here, I'll take a back seat to decide first, and then I'll tell you what are my findings. They said, fine, that's okay. I said I cannot be fairer than that. Or I can opt to be not to chairman, but that the government didn't agree. So ultimately, we started with 5 of us and with 1 observer and everything. I'll cut out the details, but ultimately what we saw was 2 or 3 very interesting things. First thing is that when a person stabs himself, then the blood that rushes back, that actually will come on your hand. This is known as back spatter. Back spatter is a very, very characteristic thing of self-stabbing. That means if I stab myself, then there'll be drops of blood on my own hand. But if somebody else stabs me, then there'll be no back spatter. That is one thing we thought. We had no body with us, but we had postmortem report. And the second thing that we saw there, look here, the general rule to differentiate between a homicidal and a suicidal wound is simple. For example, if I see a dead body with 2 bullet wounds in the head, I can almost certainly say it cannot be a suicidal wound, because the person will die after the very first wound if he has committed suicide. However, if it's a homicide, then there can be 2, there can be 3. Same is with heart. If I see 2 very deep wounds in heart, I can say it's not suicidal. In the case of stab wounds, if I'm seeing 2 very deep wounds somewhere in a vital area like abdomen, where the wounds were situated, then what does it mean? That and that both keep going right up to aorta. So that means if somebody stabbed herself, the first stab went up to the aorta, that's right up to the back. Then she took it out, and then she stabbed back, and then again it went to the aorta. So 2 deep wounds. Now, there were 2 deep wounds, and there were no back spatter on the hand. Certainly, it was not described in the postmortem report, which I think they would have described. On the basis of these 2, and a host of other findings, which probably will take a lot of time to describe, but I'll cut out those because they may not be so interesting to you. But on the basis of these 2, and then these were written in the report. So there was no question of influencing everybody. We just said, I asked everybody, this is the thing, is everybody comfortable? We are going to write that the pattern of injuries is more in favor of homicide. So we are not committing ourselves that it's homicide, but we are only saying it's more in favor of homicide. Everybody agreed with that, and we wrote that and we signed it. The case went to the court, and as is the tradition, they only call the chairman to testify. Only I went there. I saw Shoaib Ilyasi there for the first time in person. He was standing, and on the basis I heard he was convicted. This I regard as one of my good cases, if not best, where you turn the earlier judgment, or whether you come to a different conclusion based on some reasonably good findings. In forensic psychiatry, you see, there are some cases like in forensic psychiatry, you don't have that much dramatic cases. Mostly, we just go there to like prove whether this person had had a capacity to form a guilty mind or not. So in forensic psychiatry, I can't tell you of some dramatic cases of my own. Certainly, I can't remember right now, but historically, there are one or two. If perhaps one or two, or if you are interested, I can tell you. Otherwise, we can move on to some other things. Vivek is saying Arushi Talwar case. Now, Vivek, Arushi Talwar is not to do with forensic psychiatry, so we'll probably preserve it for the last. And we can go on to the next, you see, my part of my talk. Now, in forensic psychiatry, I think the deciding factor in most of our cases are whether the person has mens rea or not. Mens rea is a Latin term, which means whether you have a guilty mind or not. Now, it's a Latin term, M-E-N-S, mens, rea, R-E-A, rea. And so if you have a guilty mind, you have mens rea. But if it is accompanied by a guilty action, that is actus reus. Actus reus is the guilty action, A-C-T-U-S, R-E-U-S. So if I can tell you a simple formula, mens rea plus actus reus is equal to crime. So if a crime has to occur for which you have to be punished, then you must have both mens rea as well as actus reus. What happens in an insane person is that an insane person can actually throw stones at you and can kill you. But he's not supposed to have mens rea. He doesn't supposed to have a guilty mind because he's insane. He cannot form a guilty intent. That's actually the concept of the law. And this has not come overnight to us. Initially, if you go to the history, initially they would hang even an insane man if he had committed a murder. But this all changed with the McNaughton's case. Probably you heard about it. McNaughton was Daniel McNaughton. He was a Scottish man who was actually an insane person. And he thought that British Prime Minister actually going to kill him. In all probability, British Prime Minister never even knew him. However, he just had a thought that British Prime Minister is going to kill me. It's an 1843 case. And he went to, in order to prevent him from murdering him, he thought, why shouldn't I murder him? So Daniel McNaughton, a completely insane man, goes to the house of this Robert Peel, waits for him for not for 1, 2, 3 days, and then he sees a person coming out who is not actually Robert Peel, the Prime Minister, but his secretary, Robert Drummond. So he kills him point blank and Drummond dies. He's taken to court and everybody thought that he will be hanged. Everybody thought he will be hanged because it was a law till that time. Even psychiatry was making a lot of, you see, advances. Judges were also becoming very smart, intelligent. They were also understanding psychiatry. And they also came to know that psychiatric people doesn't have a guilty mind. So the first time in history, they, of course, he was implicated in the lower courts, but in the higher courts, the House of Lords, when it went up to the House of Lords, the House of Lords actually acquitted him. And they said that he should be rather sent to hospital. So he was committed to Bethlehem Hospital. At that time, Queen Victoria was the, you see, reigning queen. And she became very angry with the judges. And they asked she asked the judges some questions because there had been some assassination attempts on Queen Victoria also. So she was not in mood she did not take this judgment in a very light way. So she asked those judges as to why you have released him. He should be hanged. And they gave a very comprehensive answer, summary of which was incorporated in British law as Macnaghten's rule. This is one of the few rules which is made after a criminal. It's not like Newton's law or Charles' law or Boyle's law, which is made after scientists. This rule is actually made after a criminal. There are very few rules, probably one or two others, which have been made after criminals. And this is a rule made after criminal, Macnaghten's rule, which is taught in all psychiatry and in forensic psychiatry books. And the rule, although if you read the actual rule, it's a very long rule, but in very short language, it says that if a person has done something about which he did not know what he was doing because of his insanity, then he will be set free. He will not be supposed to be guilty of that crime, but he would be sent to jail. And English people were actually ruling us at that time. So in 1860, they made Indian Penal Code. Very few people know that Indian Penal Code is actually made by Britishers, not by us. Just after 17 years, they made Indian Penal Code. And Britishers, they gave us a very good law. Whatever law they had, they just gave us a mirror of it. So Macnaghten's rule, they entered in our code as Section 84, which is a very popular question which is asked these days. Which is the section in which Macnaghten's rule is incorporated, and the answer is Section 84. Now, if anything happens today, the people will always take advantage of Section 84. Now, after, Macnaghten's rule, some other very important cases come which actually modified the rule further. Now, imagine in Macnaghten's rule, the main idea was that the person must not be knowing what he's doing. That means his cognitive aspect is blocked. We have certain situations where you know what you are doing, but you cannot control your actions because you have a voluntary disorder. So the problem is not with your cognitive part, but the problem is with your motor part. That means, you see, you have actually three parts of the brain. I mean, nobody knows what is the actual structure of the mind, but very broadly, if I can give very broadly, one part of it is cognition. That is what is coming in through senses. I am seeing, I'm hearing, I am touching. This is cognitive part. So my cognitive part can go wrong. I can start hallucinating. I can start hearing sounds. I can start when you're talking about cases. We once dealt with a case where a person used to think that somebody's sharpening knives. That kind of sound used to come in his ears, and that sound used to come from the next room. That this sound is coming. He was having auditory hallucinations, and he got so tortured by those sounds that ultimately he thought that I should go there, and the wife was actually sleeping, so he killed his wife, thinking that she was the one who was sharpening knives, and as I entered, she just feeling that she is sleeping. Now, when this man was sent to us, of course, I am not a psychiatrist, so in the board, a psychiatrist was there, but the other person was me to advise him on the forensic aspect of it. So we sat together, and then he ran some kinds of tests, and then he told me, yes, he is really hearing the sound. So I said, yes, if he is having auditory hallucinations, then probably she must get, benefit of this Section 84. So we wrote in our report this thing. Another case, that I remembered since this thing. You see, some people are having delusions. There's a very common delusion, that's a delusion of infidelity. Now, what is delusion of infidelity? Delusion of infidelity is that somebody's wife is actually cheating on him. Now, this is not correct. You know all what is delusions. But he actually was having delusions. So under that delusion that he's having, his wife is cheating upon him or she goes around with other people, under that delusion, he killed her. Now, this is a very tricky case. You are having delusions, but are you entitled to kill? The answer is no. Why the answer is no in this case? Because in all cases, earlier I told you the example of a lion, that he's thinking, I am being faced by a lion, or he's a snake who is going to, bite me and kill me. Suppose a lion actually comes, or suppose you just turn that thing into reality and then think what a normal person would do in that case. A normal person would kill him, the snake or the lion. So probably he was then justified. But suppose somebody's wife is actually infidel. Is he entitled to kill her? No, he is not entitled to kill her. All he can do is either divorce her or call the meeting of a family so that it can be corrected. Or if nothing happens, divorce her. But under no circumstances he can kill her. So despite the fact that he had delusions of infidelity, this was a correct fact, yet he couldn't get the advantage of Section 84 because he was knowing what he was doing. So the main thing is you must know what you're doing. If you know what you're doing, then you are guilty for it. And that I think should be very, very easily understandable to all of you. Now, I was talking about the three parts of the brain. One is the cognitive aspect. So if your cognitive aspect is wrong, for example, you are hallucinating, you are having illusions, or you can't see things properly, then of course you will get benefit. But if the voluntary part, the motor part, the another third is wrong, then you can be, because now let me give you an example. There's a disease called kleptomania. Kleptomania is an irresistible impulse to steal. Now, many of us do the mistake of thinking that a shoplifter is actually a kleptomaniac. A shoplifter is not a kleptomaniac at all. He is a thief and he should be punished for it. And shoplifter will lift things of value. Kleptomaniacs, surprisingly, some of them are very rich. And the kind of things that they pick up are like a small button or a small pen or a pencil or a sharpener, things of very small value. And they know that this thing is useless for them. And they know that they can probably buy it because they're very rich, but they just cannot control it. That's kleptomania. So kleptomania, any impulsive disorder, when they say you have a stealing impulse, this means you just can't control it. You will do it. And we once went with the police to the house of a kleptomaniac who was a fairly rich man. He had a big sack full of all these knickknacks, a small pencil, rubber, and this big sack. And he had all lifted from here and there, and he had not used any of these things. So these people are kleptomaniacs. Now, of course, kleptomania, this is a very, even if somebody actually lifts, you can actually give him some fine or maybe send him to jail for 1 or 2 days or something like that. But there is a irresistible impulse to kill. This is known as mutilomania. Usually, this mutilomania is in relation to animals. That he will have an irresistible impulse to kill a rabbit, for example. So what they would do is they would pick up an animal, a rabbit, or even a squirrel or some. They'll pick up some animal and start, mutilating it with a knife. They do it to an animal. These people are known, and well, even this can be understood. But there are mutilomaniacs with respect to people. So they have just an impulse, and they will go to the people and they would kill somebody simply because they have mitulomania. Probably 15 to 16 years after McNaughton's, a actual case of mitulomania came before British court. Now here, when they applied the McNaughton's rule, he failed. Because what is McNaughton's rule is also known as right or wrong test. Why it is called right or wrong test is whether the person knew what I'm doing is right or whether he didn't know it. So if you apply right or wrong test on this fellow mitulomania, he knows what he's doing. But he simply couldn't control his action, that too because of his mental disorder. Now, in the lower court, he was tested by McNaughton's rule, and he was pronounced guilty. But his lawyer appealed in the higher court, and he said, look here, you have covered one compartment of the brain, that is cognitive aspect. We jolly well know that he is having a disease of another aspect of the brain, that is the voluntary aspect. How can you not give him, relief when you are giving cognitive aspect relief? Why are you not giving this aspect a relief? And surprisingly, probably not so surprisingly, the higher court actually gave him a relief, and this came to be known as irresistible impulse test. Now, so after McNaughton's rule, we had a second rule, irresistible impulse test. So what McNaughton's rule was in relation to cognition, irresistible impulse test was in relation to what is afferent in one case, efferent in another case. So there was a problem of recognition or cognition in one case. In other case, there was efferent. There was a problem with different part, and they gave him relief. And we started having irresistible impulse test also. Now that left the third part. The third part is emotional part. So you have the three parts. If you read your psychiatry books, they are known as cognition, conation, and affection. Cognition, this is in psychiatry books. Sorry. So cognition is, you see what's coming in. Conation is what's going out. And affection is what is staying in. That is your mood disorder. Now, surprisingly, it had to happen. In 1952, you had a case where you had a disorder, the third compartment. Now, his name was Monte Durham. He had a kind of a disorder where he would brood for long periods. He had some kind of a endogenous depression. He would brood for long periods, and then he would suddenly think that, this life is not worth living, or things like that. Under this depression, people have actually committed murder. Because suppose there have been cases where a businessman, for example, he lost a lot of money and he was already having endogenous depression. Now he's in further depression and he says, oh, life is not worth living. And my wife and my son, what they will do after me? And they are also, they are nothing without money. And he's having this depression. So ultimately what he does, he says, I will kill both of them and then kill myself. So he kills his wife, he kills his child, and then as he's going to kill himself, he's caught. Such cases have occurred, but this was not the case of Monte Durham. Monte Durham, in his affective disorder, somehow he stole a car. Now, I do not know how he stole a car with that kind of a depression, but ultimately, he was able to show his hospital records and show to the judge that he had this kind of a affective disorder. His exact affective disorder, I'm not remembering correctly, but he had some kind of a, disorder of the third compartment, that is emotion. And the lawyer said, to the judge was a man called David Salon. He said, sir, you are giving relief to cognition, you are giving relief to this impulses. Why not to emotion? This fellow is all the time depressed. He wants to have a car or whatever, so he took it away. So why don't you, and after all, he has returned the car also, so why don't you give him relief? And surprisingly, he was given relief in this. This came to be known as Durham test. Now, Durham test, if you actually read it, it's very complicated and very difficult to understand, because it says if the action is as a result of product of his mental disease or mental defect. And now some people think that product is something like a mathematical thing, that mental disease into mental defect. No, they said mental disease is something which can grow, things like which can increase, just like schizophrenia or your depression. And mental defect was something like IQ disorder. So product was the result. So let us not go into these words, but to sum it up, the moment he covered the third block, he actually made the entire mind was covered. And suddenly people like drug addicts, alcoholic people, prostitutes, all kinds of people who do illegal actions, they started taking one or the other relief, and they used to get relief. After 1952, if you see people taking advantage of Durham test or taking advantage of insanity test, suddenly they rose very high. It came to such a pass that one person in a joke said that situation has come to such a level that now the criminals are saying this: look here, if I have committed a crime, I'm not normal. I'm somewhere abnormal, because a normal person would not commit a crime. And if I'm mentally abnormal, and since all the three compartments are covered, I must be given this relief. So all criminals will go free. It was also said that this judgment gave the psychiatrists a blank check. Giving a blank check means you write whatever and bank will give you that amount. So psychiatrists could actually write any diagnosis, and this diagnosis had to fit one of the three compartments, and the person would get relief. And it actually became very, very uneasy for judges to convict people who could take slightest of the excuses. If he was having any kind of a mental disorder, then he will take that thing. So ultimately, David Bezalon himself, in a judgment in another case in 1972, he said in his judgment, I was very wrong to be so progressive as to go so far as to cover all the three compartments. I should never have done it. And we are quite fine with just two. And just for information, I'm telling you, in most jurisdictions, even in the United States, only the cognitive aspect is covered, not even the voluntary aspect, certainly not in our country. Even in our country, you know what happens when the baby blues, then when this when the mother who gives birth to a child, she sometimes kills him. You know that it's because she can't resist her actions. This is known as postpartum insanity, isn't it? Now, this postpartum insanity, because she knows what she's doing, but it is irresistible because he's crying or whatever, and there's some hormonal imbalance because of which she has this problem. Now, in many countries, this postpartum insanity has been given relief, and I personally think she should be given a relief, because it's just a irresistible kind of an impulse, but this no relief is given to for this. Although high courts have said in our country itself, many people do the mistake of thinking that infanticide is killing of a child below 1 year by anybody. No, it's not that. It's killing of a child of 1 year, below 1 year, by the mother herself. Only then it is infanticide in the true legal sense. Otherwise, it's infanticide. The father kills or any other person kills, then he will go to jail for any other murder, because the law does not differentiate between an infant and this thing. But if the mother kills, then in certain countries, for example, in UK, in USA, she will get relief, because it's almost like an irresistible impulse. So ultimately, this Durham's rule was removed, and now in most jurisdictions we have only McNaughton's. In some, even in US, in certain jurisdictions you have irresistible impulse test, but not in all. Probably in 3 or 4 only. So with this, we finish the second part. So you have any questions so far? Any questions so far? If you don't have any questions, then we can conclude with something on Mental Health Care Act that we have. But that's not going to be like of much use or whatever. But anyway, any questions? Nishta, do we have time?
So we are just about to wrap up. So maybe we can wrap up in the next 5
I
minutes.
also think so. So, but I would be very happy to take questions if you have any.
Sir, sir,
Yes.
myself, yeah,
Rakhi.
Rakhi.
Oh, Rakhi, welcome. How are you?
I'm fine, sir.
Yes.
Sir, I would like to ask those who have some mental disorders or who are very emotional persons, if they commit something that comes under the category of crime, so according to our law, will they be punished, or due to such hormonal changes or anything, they are not dealing under that act, or they can be
Dr. Rakhi, that's a good question, but our law is just what Britishers gave us in 1860. That is, if you, in our law, there is only one test. You just think whether he was able to understand what he was doing at the time of doing it or not. If he was able to understand it, then he will be given punishment. In your case, you are saying he is having some emotional disorder. I don't know what kind of emotional disorder you're talking about, but the test will be. Yes.
Yes, sir. This is suppose in so many violent cases at homes with wives and with children, we found that some persons taking alcohols and they are under influence of some drugs also, and at that time they treated their family in a bad manner, and sometimes they use weapons, and in the morning then they regret for what they did. So at that time, if they committed some such sort of cases, they are not culprit of doing that?
100%, Dr. Aki. I've dealt with several such cases. But your question reminded me of another thing, that is usage interval. But in your case, 100% it will be, because if you will take alcohol, if you take drugs, if you are misbehaving with your wife, actually these are the kind of the people who began taking advantage after the Durham's test, and that's why they woke up and they said, no, Durham's test is no more valid. At that time, they were taking benefit of this by some trick. Or these lawyers are also very clever. They would somehow fit them somewhere in the cognitive aspect, in the emotional aspect, and then they will take benefit. Now, this law, I think, anywhere in the world, these people will be punished anywhere in the world, not only in India.
Okay.
Is this okay, Dr. Aki? Now,
thank you so much, sir.
Okay, even in you see, insane people, there's a specific disorder called manic depressive psychosis. So you have a manic period, then you have a depressive period, and then you have a manic period once again. And these periods can run for like days. For 2 to 3 days, you can have manic period, then you have a depressive period, and then you have a manic period. Now, during mania, you don't know what you're doing. But during depressive phase, you understand, you know what you're doing. So if you commit a murder during depressive phase, then even though you are a patient of bipolar disorder, or even though you are a patient of manic depressive psychosis, you would still be responsible, because at the time you committed the murder, you knew what you were doing. But if the same person committed the murder during the manic phase, then he will not be responsible. So that is why the important thing is, even in the British judgment, they said who at the time of doing it did not know what he was doing. So this is very important. So lucid interval, people, if they commit a crime during a lucid interval, then they won't be responsible. But if they commit during a manic phase, then it's okay. And to determine whether this person was at that time in a manic phase, or because he can certainly give you a certificate that look here, I'm having treatment for this, and probably he is having treatment. But you got to determine whether at that time he was in depressive phase or whether he was in a manic phase. This is what the psychiatrist would do. Again, here he is examining him not for treating him, but to help the judge understand whether he knew his crime at that time or not.
Sure, sir. So there are so many questions from the audience, but due to the time constraint, we won't be able to take them all. So we would be wrapping up with this one last question. So we would really want to know that what is the need for understanding forensic psychiatry, especially in today's era when conditions are like these and mental health problems are on more rise, and how to spread more awareness regarding the field in the upcoming future doctors.
Nisha, I couldn't get your first part. What is the need of understanding forensic psychiatry in the modern era when? I couldn't hear after that.
So, what is the need of of understanding the term forensic psychiatry, or understanding what the implications of it are in today's world when mental health problems are more on rise than ever, and how to spread more awareness in the upcoming doctors regarding forensic psychiatry as a career option?
I mean, I was not able to understand this question very well because, I mean, there is a need of forensic psychiatry, isn't it? We all need forensic psychiatry. I've already told you, we are a crime-ridden society, and people may begin to take advantage of this law of 84. We got to know about it. I mean, what's the problem? I couldn't understand this question very well, actually, because there is every need to understand this. It's just like saying what's the need of the law itself. Don't you think so? Maybe.
Yes, yes, sir. So, I mean, the question essentially is how do we make more, how do we make people who are pursuing MBBS right now to be more aware of this field, to be made more aware of forensic psychiatry as a career option?
Probably take more lectures like this. I can't. I'll be unable to answer this. I mean, I'm very bad at making most people aware. I can take more lectures on it. More diverse people. Sorry, I cannot answer better than that.
Sure, sir, sure.
Maybe
sir.
we can take another question. I'm sorry to be so short in this. Maybe some other question. No, there's no other question.
So there are other questions.
Can I ask, ma'am?
Yes. Rakhi, how are you?
I'm fine, sir. Very interesting insight by you, sir. It's a totally different topic for me. Sir, as usually we see that in a home, one person is very arrogant and he do something very bad in the evening from morning to the evening, and in this distress period, the COVID period, most of the families and in the families there are divorces between the husband wives, and sometimes they are killing also by one person to the other person. And the reason behind is one person is very arrogant. He pinches every time the other spouse, and then in the mid period sometimes it happens that who is feel innocent and cheated one, he does something bad act emotionally. Then how can we count it according to you in the forensic psychiatry, whether it is a very big culprit he will be, or it will be as an innocent person? How can we count it?
As I told you earlier, this is same answer as I give you earlier. These people who are mistreating their wives, their family members, especially under effects of alcohol, they're given no relief, absolutely no relief.
Sometimes, no, sir, my answer is reversed now. The person is not doing any killing. even the other person who is innocent, who is feeling depressed in such situation, if he or she does something bad in these circumstances, then how can we
Bad,
differentiate between these
bad,
two?
bad means that he's being cruel to his wife, not killing her, but being cruel to his wife, right?
Nay, a man is cruel to his wife, but in the meanwhile, his wife kill his husband or
अच्छा,
somebody
अच्छा,
because
वाइफ ने हस्बैंड को किल कर दिया, राइट? राखी खन्ना हैज गॉन. हाँ, आप कह रहे हैं वाइफ ने हस्बैंड को किल कर दिया.
या सर आई मीन टू से कि इतना ज्यादा
अच्छा,
जैसे
यानी कि
कंडीशन खराब कर
अच्छा,
देते हैं कि
अच्छा, हाँ,
ऐसा सोच में आता है कि नहीं भाई, मतलब वाइफ या हस्बैंड में से कोई एक जना बहुत ज्यादा ब्रूटली बिट्रेयल
हाँ,
फील करता है
मैं समझ गया,
और वो करना नहीं चाहता, बट
मैं समझ गया.
अनवांटेडली ही डू दैट, बट अनवांटेडली ही डू दैट.
हाँ, मैं
सो
समझ गया आपकी
एट
बात.
स्टेज वो फॉरेंसिक साइकेट्री में कैसे
हाँ,
होगा सर?
अच्छा, मैं रिपीट करता हूँ आपका क्वेश्चन, अगर मैंने ठीक समझा है. यानी कि वाइफ को उसने इतना हैरेस कर दिया आदमी ने कि वाइफ ने उसका किल कर दिया, उसको किल कर दिया. यही आप कह रहे हैं ना? देखिए, हाँ, देखिए, ये केस बहुत हुए हैं, इस तरह के केस जिसमें कि where they have taken the defense, the wives have taken the defense that they were so badly you see oppressed by their husbands, who treated with cruelty that they murdered. तो उसमें बेनिफिट लेने की कोशिश करते हैं. But this benefit is not given anywhere in the world, because she had a simple option of divorcing him or living away from him, going to the court and saying that please give us judicial separation. Judicial separation तो एकदम से मिल जाता है. So she has many options. You know, whenever you have better options, safer options, then you don't resort to killing. And if you resort to killing, then most courts are likely to think that you are simply hiding behind a true fact, but it's a wrong defense you are taking. You should not have done it. You see, Raki, then there is no end to it. You just abuse me and I kill you because I am angry by that. I am tortured by simply your abuse. So where will it end? It will end nowhere. So one is tortured by repeated abuses. One is tortured by just one abuse. So he will also say, sir,
both will be treated same, sir. Both will be treated same.
No, yeah, this, and nowhere in the world they will be given relief. I know such cases where they have taken tried to take relief, but this relief was not given. And the answer is very simple. You could have simply separated yourself from this thing. ये हो सकता है कि वो बच्चों को उठा के ले गया, बच्चों को किडनैप कर दिया, बच्चों से मिलने, इस सब के, all these things have judicial remedies. Whatever has a judicial remedy, yes, I told you about that. I told you about
that's what I like to ask, sir, ki as a forensic medical doctor or the psychiatry, the three lobes of our brain, if we scan them and if there comes some disorders, then can we change the direction of the case? That was my question.
मुश्किल है डायरेक्शन का केस चेंज करना. बहुत सिंपल है, क्योंकि ये तो psychiatrist will come and immediately say that this was a cognitive disorder, this was a impulse disorder, this was a emotion disorder. तो वंस वो बोलता है कि कॉग्निटिव डिसऑर्डर नहीं है और कुछ है, तो वो प्रोसिक्यूट हो जाएगा. लेकिन अगर कॉग्निटिव डिसऑर्डर है, कॉग्निटिव डिसऑर्डर का मतलब उसे समझ में नहीं आ रहा था कि मैं क्या कर रहा हूँ, देन
ओके, टोटली मेंटल डिसऑर्डर.
हाँ, बिल्कुल, सिजोफ्रेनिया जैसे होता है, जिसको हम पागल कहते हैं आम भाषा.
सो मच सर, थैंक यू सो मच सर.
बाकी गुड क्वेश्चन. हाँ, निष्ठा.
Thank you so much, sir. This was such an amazing spellbinding session. The past year has really been amazing, and I'm sure we all have had a lot to learn during the session. I would like to really thank you, Dr. Anil Agrawal. He's professor and ex-HOD, Department of Forensic Medicine and Toxicology at Maulana Azad Medical College. Sir has also authored several renowned bestsellers in the field of forensic medicine and toxicology. Sir is chiefly known for his online journal, Anil Agrawal's Internet Journal of Forensic Medicine and Toxicology, and has also proposed a new classification of necrophilia and is one of the leading authorities on necrophilia. As we have all seen through this session, Sir is very keen on teaching and blends nicely the concepts of complex medico-legal forensic medicine into the art of storytelling. Unfortunately, that is all the time we have had for today. Though there have been plenty of other questions by participants, but we would not be able to take them due to the time constraint. So we are truly thankful to you for your precious time and sharing a piece of your knowledge with our audience today. This seminar was very much needed for everyone. I would also like to use this opportunity to extend my heartfelt thanks to Dr. Shubhamanand, President and founder of GAIMS, and everyone involved in this global healthcare conclave. Thanking our collaborative partner, AAPI, for their efforts. A special thanks to all the audience present today for being connected. Stay tuned for more exciting sessions and workshops. Thank you, everyone. Please take care, follow COVID-appropriate behaviors, and stay safe. Thank you so much.
Thank you, Nisha. Thank you very much.
Thank you
God
so
bless.
Thank you so much, sir.
Thank you, Rakhi, for coming. And we can talk about this thing after just now, right?
Right, sir.
Okay.
Sure.
Should I call you or you will call me?
I'll call you, sir.
Okay, please.
Thank you, sir. Good